I think the controversies right now in terms of managing lymphoma, whether it's non-Hodgkin lymphoma or Hodgkin lymphoma, is that we have so many promising studies that are emerging and so many new agents. And so particularly at this meeting, the practices are likely going to change so quickly. We've got CAR T that's potentially going to move into second line. We've got bispecifics that are likely going to be approved in that third line or later space. Hodgkin is becoming so challenging now with the incorporation of targeted agents such as brentuximab vedotin or checkpoint inhibitors, potentially the elimination of radiation. So the challenge for, I think, your average clinician is how do you reconcile all of these studies? What is the preferred approach for each lymphoma subtype? What's the preferred sequencing? And so I think that does fall back on us to make sure that we interpret these studies with the nuances of the patients they were studied in, how we interpret this in terms of the era it was conducted. And so I do think that where we're headed is potentially away from chemotherapy and smarter, more rational, either immune therapy or targeted approaches. And I anticipate that therapies may get longer and longer. And so this may turn into more of a chronic disease, particularly for our indolent lymphoma subtypes.